We can bring you more now on the annual report card from the Australian Medical Association into the public hospital system. We're joined from Brisbane by the President of the AMA, Steve Hambleton. Steve, good morning.
Good morning.
This is not the kind of report card you'd like to be handing down.
No, sadly, and the AMA has brought out a report card every year for the last few years to track some of these figures, and we're the only group that's longitudinally tracking. What we've added this year, though, is to actually look at the funding that we're spending on health compared to what we were promised to be spent. We've actually looked back and we've found that there's $134 million less spending from the previous government. And when you compare what was promised to be spent in the future, it looks like a $400 million gap over the next 3 years. Now is not the time to reduce spending for our public hospitals.
Just before we get to the figures that you're revealing today, I just want to ask you one more question about that $134 million drop in public funding. You're saying between what period and when? When did this occur, according to you?
This is 2012-13. We looked at the end-of-year fiscal outlook about what was promised to be spent and what was spent. So under the previous government, there was a gap in what was promised and what was actually spent. Significantly more money was put into health, but we need to make sure we don't underspend on health, and this is an area of concern. Now that theme has been carried forward by this current government, which is looking like a $400 million spend or underspend over the next few years. It comes at a time when we're not meeting our targets, and if we at the trajectory that we're moving at now, we are improving. It's going to take another 6 years to meet the target that we're meant to meet this year.
So which targets are not being met?
Well, I think there's two targets we like to look at, and that's the number of people who are classified as urgent in our emergency departments. Now, we'd like to get them seen within 30 minutes. We're only seeing them, 68% of those people, within 30 minutes.
And why is that, Steve Hambleton? Can I just jump in there and ask why is that? Why in so many cases does it take longer than 30 minutes?
Well, we have really difficulties in our emergency departments with large numbers of people turning up, and we're having difficulty getting them into the hospitals. So often it's bed block. There are patients who've been admitted who are actually still in the emergency departments, so we're having trouble getting into the hospital beds. Now, of course, our hospital beds, we need to make sure that people who are ready to go home can get home. People who can go to step-down care go to step-down care. And so we've got bed block in our hospitals because of lack of capacity. Now, if we can turn that around and do a system redesign, working closely with our doctors, we can certainly make a difference, and that's what they've done in Western Australia. But of course, those targets, the emergency targets, work against those elective surgery targets, and that's why we're not seeing a reduction in those targets either. It comes back to capacity.
They seem to that figure seems to have stayed the same for quite some time, the elective surgery level.
Well, it certainly has, and you know, our number of beds per population over 65 continues to fall. Of course, that's the needy end of our lifespan, so you know, we do need that capacity. Now, overall, if we want to reduce costs in our health system, we have to invest in primary care, but we still need to make sure our hospitals are properly looked after.
You spoke there about system redesign being needed in order to deal with bed block. When you say that, that's a separate issue, isn't it, to simply receiving more money from the Commonwealth?
Well, I think the medical profession does want to work closely with the governments, both state and federal. We should look at Western Australia, where we are meeting targets. In fact, they're exceeding targets in the emergency department. And the difference there is that they actually engage with the workforce, looked at the processes that are underway in those hospitals, and they're actually seeing more patients in their emergency and yet still meeting targets. That's a very good example for other state governments to actually work with their workforce, look at system redesign, use the expertise in the system. But it doesn't make up for that extra investment at the same time.
Can you just tell us a little bit more about that? How is it that working with their own workforce and their staff in Western Australia, they've managed to see people more quickly and still do their job well?
Well, one of the major problems in our emergency departments is that they fill up and you simply can't see the next person. And we've seen those images of ambulance ramping. Now, in Western Australia, in the major hospital, they actually met with all the staff and they said, well, we've got to make sure we can actually get patients out of emergency appropriately into the hospital beds. What's the problem? Some of the problems was getting people discharged appropriately, so they looked at the discharge process. Some of that was actually step-down beds, so people who needed to recuperate outside of a public emergency hospital. Some of it was aged care and people moving into nursing homes. So if we got the people out of the hospitals, we changed the way the people were admitted to the wards, and so they accelerated the whole system. that freed up beds in emergency and allowed them to meet the targets, as well as seeing more patients. So it's actually a very good example of how you can actually do system redesign, not just look at one part of the health system, but look at the whole health system together with the people who work in it.
At the moment, the way that it stands, and with this report card and those two key areas in particular not being met, what do you say is the situation then for Australians who might go to the public hospital? Are they being cared for well? Is this creating a potentially dangerous situation for them?
Well, I think we can reassure people that when you get to your emergency department, when you get to our public hospitals, you'll receive excellent care. In fact, we talk about Category 3, about the concerns about 30 minutes. If you're Category 1, if you've had a heart attack, you'll be seen immediately, and all hospitals are meeting those targets. So we do want to make sure that we reassure our population, but on the other hand, we've got to look at the future. We've got to make sure we maintain good health. An investment in primary care, dealing with issues such as tobacco and alcohol and overnutrition, under-exercise, will save costs in the health system long term. Good access to primary health care is very important. Maintaining access to your GP, so that health maintenance, health promotion, we will get costs down, but we've actually got to do a lot of things, not just in the health portfolio, to make sure that we keep our population healthy.
And just finally this morning, Steve Hambleton, I wanted to ask you about the prospect of Medibank Private being privatised and what you think that might mean for those who have those insurance policies with that company, and whether it might mean something significant for the cost of premiums.
Well, we're watching this very closely. Medibank Private is a very large company with a very large dividend to government currently. Now, it's very different to the situation we found ourselves in a decade ago when they were talking about this last time. The company has been corporatised, so it's acting like a private company. But we do need to understand, if it is sold, whether that decreases competition, because we need to make sure that private health premiums are affordable. Enormous numbers of surgeries are done in the private sector, and we need to keep that balance between public and private working so people can continue to access their private health insurance. Now, if it was gobbled up by another player, that may actually decrease competition. So we need to understand in the analysis before it's sold what the impact is going to be, and if there's no impact on premiums, we can reassure our population, but we haven't seen those figures yet.
But no one can assert that there will be no impact on premiums.
Well, we certainly can't, and that's the major concern, and we'd like to see that analysis. And in the scoping study prior to sale, we've asked the government to make sure that they actually address this issue very carefully, because that will actually impact on the decision about whether it's actually going to impact on premiums or not.
Steve Hambleton, we'll leave it there. Thank you.
Thank you very much.